Good morning. I'm Rollie Flynn. I'm the president of the Foreign Policy Research Institute, a nonpartisan think tank based in Philadelphia. I'd like to thank you for coming today. We have a really interesting discussion on educational and health issues affecting today's women and girls in Africa. And we have a superb panel this morning with Jimmy Kolker and Renee Sanders, and our own Charles Ray, Ambassador Charles Ray, will be moderating the discussion. Charles Ray is a member of our board of trustees. He's also chair of FPRI's Africa program. But before that, he was the US ambassador to Zimbabwe and also to the Kingdom of Cambodia. And before that, he had a 20-year Army career. So before we get started, a few housekeeping notes. If you have questions, and we encourage you to have questions and to ask them, put them in the Q&A button at the bottom of your screen. Just click on that button. You'll be able to add your question in there. We'll also have a map of Africa in the chat box. So a link to a map of Africa if you want to orient yourself. Finally, I'd like to thank our members and our trustees and our supporters for all they do to help us keep FPRI vibrant and an important part of today's discussions of the challenging issues of the day. We couldn't do it without you. If you're not in one of those categories, we'd love to have you become a member. So it can be easily done on our website, www.fpri.org. Sign up today. We encourage you to do that. So without further ado, I'm going to turn it over to Ambassador Charles Ray.
Thank you, and good morning to all of you. I apologize if I sound a little tinny, but the weather here in Maryland, where I am, has been changing so much, my sinuses can't decide what to do. There are a lot of issues in Africa, as we've tried to show in a lot of our presentations over the last 2 years. And all of those issues, frankly, have an outsized impact on women and girls on the continent. And I think it's appropriate that for Women's History Month that we address the issue of women and girls in Africa. And this morning, we will be talking about health and education and its impact on these two demographics. With us today, we have two people who have a lot of experience in this field. First of all, there's Ambassador Jimmy Kolker, who currently is the senior advisor to the global COVID coordinator and health security's special representative at the Department of State, who's formerly ambassador to Uganda and Burkina Faso, and has served in the Department of Health and Human Services, if I remember correctly. Also, we have Ambassador Robin Sanders, who's the CEO of an organization that focuses on trade and investment in Africa. She was ambassador to Nigeria and to the Democratic Republic of Congo, and was the Africa director at the National Security Council. I apologize to those of you who are expecting a third speaker. Professor Fatima Sadiqi from Fez University in Morocco unfortunately won't be able to join us this morning, but I think our two panelists will more than fill in for her absence. And so without further ado, I would like to allow our two panelists, starting with Ambassador Kolker, to introduce them.
Thanks, Charlie. You were freezing there for a minute, but I'll go ahead and welcome the guests. And I see from the guest list that there's some very distinguished people in the audience who know a lot about this as well, Foreign Service colleagues and other experts. There is an origin story. I was ambassador to Uganda when the program called PEPFAR, the President's Emergency Plan for AIDS Relief, began, and Uganda was its showpiece. And so in addition to my 30-year career in the Foreign Service, I acquired a couple of comorbidities that I worked on AIDS and then on global health, first in the PEPFAR office in Washington at State, but then also at UNICEF in New York, where I was head of the AIDS division, and then as head of global affairs at Department of Health and Human Services in the Obama administration. But given my AIDS interest and background, I wanted to start there, and I was going to focus on Eastern and Southern Africa because we had experts from West Africa, Robin, and from North Africa, who unfortunately can't join us. But HIV is certainly the big story of this century in Eastern and Southern Africa, and 60% of the HIV positive people in Africa are women, and that is grounded in large part by the incidence, the new infections among women 15 to 24 years old. They are only 10% of the population, but account for 25% of the new HIV infections in Africa. And in fact, among girls 15 to 19 years old, among adolescents who are getting HIV, 80% of them are girls. And this was based on statistics from an article in The Lancet by Karen Baxter, but the NIH there are some biological reasons for this. There's a 70% higher risk in identical sexual behavior between men and women. They're of course not sexually identical, but for heterosexual sex between men and women, there's a 70% higher risk for women of getting HIV infection just because of the biology and the exposure and vulnerable anatomy. But there is also a strong sociological risk, and that has to do with men's unwillingness to get tested and treated, therefore not being virally suppressed and therefore passing on HIV to sexual partners. The tendency of both genders, but especially men, to have multiple sexual partners, and gender-based violence, which is highly correlated with HIV. And it's hard to know what's causative of what. The same underlying factors of alcoholism, of sexual unfaithfulness, which are often the cause of men abusing women in their domestic circumstances, also lead to unprotected sex, lead to risky HIV transmission. There's also in the Southern Africa, in countries where male migrant labor is a major factor in the economy, a phenomenon that really is unique in that part of the world, which is that only a minority of adults are married. And many of the relationships between men and women in Southern Africa are a little bit more transactional, in that the male who's a wage earner would support a female and children, but the way to bond that relationship, to be sure that economic support is ongoing and that there's some also personal connection between the fathers and their children, is to have a child. And so there's a perverse incentive among unmarried women in Southern Africa actually to have unprotected sex, and especially unprotected sex with partners who may not be in residence. And this phenomenon, which was South African female researchers who connected to the HIV incidence and prevalence, mean that there really is a gender imbalance in the way AIDS is, both biologically, but especially sociologically, and based on the kind of social factors, social determinants of health that make this a very gendered issue, and we have to adjust our response to that. Just in terms of other health indicators, though, Eastern and Southern Africa have done pretty well in terms of maternal mortality to 100,000 live births. In Southern Africa, we've gone from the middle of the last decade, 2007, 303 women out of 100,000 who died in childbirth, down to about 185. But that number remarkably took a lift last year. In 2019, there were only 178 women who died in childbirth per 100,000. In 2020, it was 185. And the difference was both the quality of care and the comorbidities with COVID. And the fact that COVID hit Southern Africa hard this was not true in East Africa. In East Africa, the same figures were 352 women who died in childbirth out of 100,000. And in 2020, that was down to 272. And that's been steadily declining in all of Africa except Southern Africa. There was a big surge around the turn of the century having to do with HIV, which also did affect women's health in childbirth and life expectancy. Life expectancy in Africa is 63 years for men, 66 for women. Botswana has the highest life expectancy at 72 years. And among women, Mozambique is the lowest in Southern Africa at 64 years life expectancy. Kenya has 69. But there was a decrease in life expectancy for both men and women between 1990 and 2010 because of AIDS. One of the factors that also is very important in determining how we deal with the differences between genders and women and girls in Africa is contraceptive prevalence, which married women between the ages of 18 and 45 across Africa have 31% prevalence, but it varies dramatically across countries. In Kenya, it's 63% who try to prevent unwanted pregnancies. In Mozambique, only 27%. Neonatal deaths have also declined dramatically. Babies who died between the age of 1 and 28 days of life. 1980, for instance, in Uganda, there were 53 of those out of 1,000 live births. 2020, that's down to 19. South Africa, that figure is down to 10, which is actually almost a first world standard. And even Mozambique, again, the low performing country in the region went from 65 to 28 over the period 1980 to 2020 over those 40 years. So reduced by a dramatic amount. Under 5 mortality also is gendered in that in almost every country in the world, including throughout Africa, girls are at least 10% higher survival rates until their 5th birthday than boys. And those rates have fallen even more dramatically, so that in Kenya, for instance, between 1970 and 2020, the under 5 mortality fell from 143 to 38. Mozambique from 262 to 66. So the general picture of health for women and children in Africa is actually a very positive one, but with some significant red lights flashing. And we really have not brought the question of AIDS and the questions of wanted pregnancies under control. I'll just take a 2-minute now excursion into education, in which I do not have so much professional experience, but I am on the board of a NGO called Building Tomorrow, which is involved in education in Uganda. And we just heard a fascinating study by a woman called Sarah Kabe from the Innovations for Poverty Action, who did a 2-year study about school dropouts in Uganda that ended actually right before COVID closed down all of the schools. But in primary schools in Uganda, this is after a decision of the government a couple decades ago that there would be universal primary education. Girls are outperforming boys academically in primary school, and boys are dropping out at a higher rate than girls. And this has to do with academics, but especially with the economics. That's reversed in secondary school, in that there's a much higher rate of girls drop out. And that has to do with family demands, with pregnancy, with discrimination, and other things. But just looking at the primary schools, which was the subject of this study, it was a real eye-opener to me, in that this 2019 statistics in Uganda, 13% of 3rd graders could not read a single letter of the alphabet, could not recognize a single letter of the alphabet. 50% could not read a sentence. 31% could not add, and 50% could not subtract. 50% of kids in Uganda at school entry, which is normally 6 years old, were already overage, were 7 or above when they first started school. And this is remarkable, 88% repeated at least 1 grade. And that, you would think, well, that might be in 1st grade because they weren't ready, or the last year because they failed the school leaving exam, but it's not. The majority of repeaters are in 3rd and 4th grade. And the correlation with that, which seems to also to be the logical reason, is that that's when the instruction changes from local languages to English. And the inability of many kids to adjust to learning in a foreign language very suddenly after they've adjusted to school in the local language in which they almost certainly speak at home. So that only 25% of these students who are universally eligible for primary school and encouraged to attend actually complete primary school in Uganda. And the primary dropout has very little to do with even economic socioeconomic factors or gender, it has to do with age. Correlates the age you are when you're in 3rd and 4th grade and have these academic difficulties, and the age you are when you age out and other economic alternatives or family demands mean that primary school doesn't look like a good option for these people. The anecdotal evidence is that the lockdown, the kids with disabilities, food insecurity, and the economy all play a role in school dropouts. But it was a fascinating experience to me that had such a huge dropout rate. And I mean, in one way, it's inconsistent because 88% repeating a grade, only 25% actually finishing primary school, means these systems are not addressing the needs of men or women in Uganda. And the society really has a huge burden in figuring out how to deal with this problem of essentially kids who don't even finish primary school. Thanks very much. I'm sure there'll be good questions, and I hope that stimulates some thought.
Thanks a lot. Ambassador Sanders.
Yes, greetings to everyone wherever you are in the world, and thank you, Foreign Policy Research Institute, for including me in this International Women's Month program. I want to say at the onset that you know, to talk about African girls and women in this month is very, very important to me. You've heard a little bit about my background, but I'm just going to add a few things. Yes, I have a business that focuses on business and trade, but I also have an advocacy initiative, and I'm also a senior scientist at Gallup World Poll, where we look at a range of life issues, including women's health and education. So I'm going to talk a little bit in that context and give you a little bit of a global picture for the continent, as well as a focus in some instances on West Africa in particular. I think it's really important to understand that there's a nexus, or I always put a nexus with my FEEEDS advocacy initiative and my work with Gallup between education and health. Because the more uneducated a woman is, no matter where she is in the world, and particularly in Africa, there's a link between that and lack of education. And so I think as we think about these two things, always remember that there's a link, and there's also some sub-pillars that are connected. You know, being poor, of course, adds to that, because if you are poor, no matter where you are in the world, and particularly on the continent, then your access to healthcare services, but more importantly, because I've seen it on the ground there as ambassador in Nigeria, the embassy there, we had one of the largest PEPFAR programs and health programs there on the continent. And so seeing that on the ground, visiting a lot of health facilities, a lot of villages, a lot of women's clinics, I've seen a lot of really bad examples of healthcare services where women are not really respected in terms of their healthcare when they come into some of these facilities. As part of my work in FEEEDS, my FEEEDS advocacy initiative, we've looked at a number of these things, and I want to share a couple of those findings with you. First, on the continental perspective, and give you a little bit of comparison on the global perspective as a result. The Education and Health Index, we've seen recently, certainly the impact of the pandemic overall on both women's education, girls' education, and women's health. You know, the 2-year pandemic really hit women and girls very, very hard, particularly in those two areas of education and health. And we know that there'll be residual effects or impacts of that over the coming years. So not only were women and girls not receiving adequate access to education and health before the pandemic, but the pandemic made them even more vulnerable, particularly impacting many women in the informal sector because they no longer could earn incomes. For young girls, in particular, not being in school not only hurt their education progression, but it also made them vulnerable to other things. So I want to zero in a little bit more on the linkages between health and education. I'm going to start first with education. Many of you are probably aware when I talk about the impact of the lockdown and COVID on education and health for women and girls. You know, here are some really, really stark stats that might be, they were overwhelming to me, and there's certainly something that we all need to focus on and help address. But for example, girls 14 years and under, teen pregnancy increased tremendously during the lockdown, particularly in countries like South Africa, Kenya, Nigeria, and Ghana. The reports are fairly alarming. For South Africa alone, there were 900,000 teen pregnancies in 2020. 4,000 were from girls 17 years or younger, and 600 of those were ages 9 to 10. In Kenya, the stats are not as high, but they are still equally concerning. During lockdown, you had 152,000 Kenyan teenage girls become pregnant, and that was a 40% increase in the country's monthly average. In Nigeria, the lockdown caused high teen pregnancies, but it also caused a higher increase in child marriages. And that is defined by the UN standard of 18 years and below. Both these issues really challenge education for girls. In the case of Nigeria, you had a lot of girls 15 and younger being married off during the pandemic. In fact, the largest number of child brides in West and Central Africa at 22 million accounted for 40% of the child brides in the region during that time. These challenging stats means that efforts need to be redoubled to help both the African girl teen and the child mother still find a path to education, not be stigmatized, and find support for all the newborn babies for a significant period of time if the girl mom is ever to have a chance at a better life for herself and her child. A little bit prior to the pandemic, just to give you some context, I think that children out of school, particularly girl children out of school, we saw a tremendous drop in that figure during the run-up before the pandemic because of the UN Sustainable Development Goals. We had about 79 million children out of school, the majority of that being young girls. So prior to COVID, that number was 52 million, but that number since COVID has bumped up to 16.7 million, and that's a figure as of October 2021. And there's also a fear by international organizations that 99.3 million of that 16.7 million figure children will not go back to school, and that means mostly girls will not be going back to school as a result of either teen pregnancies, child marriages, or economic situations with their families. So that's a big hurdle for us as the international community to address and to overcome. In West Africa, that estimate is about 42 million children out of school as of October 2021, and the majority of that figure is also young girls. So I do want to give you some things to think about as solutions. There are others out there I'm sure that you have, but in terms of what needs to be done to address some of those things, certainly there needs to be an expansion of social worker support for families. As for many young girls to be able to go to school, to be educated, it's a family decision and it's an economic decision. And we can't forget that. So you've got to bring the family along when you're advocating for girls going to school. There needs to be financial support for fees and uniform. You need specialized social worker support that encourages village elders to understand the importance of educating the girls in their community. And you certainly need more involvement by faith leaders in particular communities. There needs to be development of remedial education programs for those girls who cannot go back to school because of either being a child mom or their domestic or agricultural smallholder farmer work duties that they have to do. And then you need to think on a policy level about making sure that childbirths are registered so that you know how many children and girls in particular there are, so that when they become school age, that there is an advocacy for them going back to school or going to school. Just to give you a continental perspective and compare that globally, On the global scale of the index that we have, with 100% being the best or the highest, both sub-Saharan Africa and North Africa fall on the lower end of that index, means that less than 50% of their girl population and female population, I should say both, fall below having access to education or have an education level elementary school or less. In West Africa in particular, which is a region of about 420 million people alone, the obstacles are great there. I've already mentioned some of them earlier. And so it's a very daunting task. There were a lot of positive things going on before COVID. Numbers had dropped, as I mentioned, but COVID has set us back, and we need to redouble the efforts. Turning quickly to health, paying attention to my time here. On health, I have put as an advocate kind of 3 pillars under the health umbrella for women, because they are very much connected. If you are a female anywhere in the world, and particularly on the continent, the other elements of health, the health pillar for you would be food security, and that not is only adequate food, but nutritious food, because they directly impact health as well, and certainly secured shelter. In the polling that we've done on the Women's Education and Health Index that I've talked about, these were always connected to health, food security, and shelter. So I cannot talk about one without at least mentioning the other. Starting with general health of women, the research showed that half of the world's women have health problems that keep them not being able to do daily activity or in some discomfort. I just wanted to highlight for the West Africa part of my remarks that the countries with the lowest index were the following, below 50%. You had Senegal, Benin, Cote d'Ivoire, Guinea, Nigeria, Burkina Faso, and Mali. And that means that half of their female population struggle with health issues. And the list goes on. There were a total of 18 countries on that list. And I just named a few where women face, of all ages, this is of all ages, face hurdles to good health. Sorry. To good health and access to health care. The other thing is that being able to afford medical services is also a hurdle. Looking at one of the other pillars that I mentioned, food security and shelter, I do have to touch on both because they are related to health. You know, food for security, we need to make sure that we're talking about both nutritious food and adequate food. That means you have enough to eat, and then what you're eating is nutritious enough to sustain you. You know, there are 29 million women on the continent of Africa that feel food insecure. That's a lot of people. A lot of that has been exacerbated by the conflicts across the region, particularly in West Africa. And then I want to say that, you know, some of the biggest challenge areas for food security for women are in a number of countries, but the top were Benin, Cameroon, Congo, Brazzaville, Gabon, Guinea, Kenya, Namibia, Nigeria, Zambia, and Zimbabwe. In a number of countries, women said they didn't have enough shelter, and if you're out in the elements and you don't have enough shelter, that does impact your health as well. So what should policymakers do? Certainly, I would put more awareness at the top of policymakers' list, more programs that meet women where they are and where they live, because traveling to clinics really is not a practical solution because both they have fear, they could possibly be harmed on the way, and there's always difficulty in leaving the communities, sometimes traditional communities, without permission of someone else. So some of the positive things I've seen in that area have been health workers creating things in villages themselves, particularly for prenatal care. In Liberia, for example, There's one program, I don't know since COVID whether it's still ongoing or not, but where they created a prenatal house that focused on prenatal care, where anyone from the village could come to that house in the village. So women didn't have to move from where they were to go to someplace else. There's an increased use of technology in this regard as well. And more effort, I think, needs to be made to find apps that work on feature phones, because most women, particularly in rural areas, don't have smartphones. But there are a lot of health apps that help remind women to take their prenatal medicine, to take their HIV medicine, et cetera. And we need to find a way with all the technology available to us to make them more available on feature phones. I've seen other creative things like in Rwanda, where drones are used to deliver medicine, particularly in rural areas, which has also been a struggle as well for a lot of women to be able to have the medical resources they need. And then you also have a lot more of I would call them traveling health practitioners or traveling healthcare providers who, travel in mobile units from village to village to be able to meet people where they are. And then the last pillar of that would be to, again, step up the social worker aspect, because it is about trying to educate the community on the importance of the well-being of women's health. And I'm going to stop there.
So thank you very much, both of you. I'd like to touch on one thing, this issue of access to education for women or for girls. And I realize that there are local cultural and economic impediments to this, but I think that one of the keys to starting to overcome this would be having a political commitment at the highest level among these different countries' leadership. What's your feeling on the amount of political will on the part of African leaders to work to try and change the cultural, economic situation to improve access to education for girls?
Do you want me to take that first?
Yeah, and then please go ahead.
I think that there's two parts to that. Having been particularly in Nigeria for a very long time, and a good bit of my work is still there. When you talk about culture and communities, particularly in, I would say for me, my experience, particularly in northern Nigeria, it has to be that effort has to be redoubled at the local level. You can make the policy decisions at the state level, of course, because the resources can be driven from the state level. But to really change the dynamic on the ground, you have to engage at the local level with local community leaders, elders, faith leaders, and it varies from community to community. Even in one state, I traveled all throughout Nigeria. I've been in all 36 states more than 4 or 5 times in as many villages as I could do, and quite a few. And so I really got a feel of how important it is to bring the local community and faith leaders along. And one example that I will give you is we had a U.S. government program where we were bringing teenage Nigerian students to the United States, including young girls, to do maybe the equivalent of their junior, senior year in the U.S. And then when they came back, we would have a sit down with the family. That was one of the things I wanted to understand, how the family viewed this and all of that. And I remember having one father tell me that, "You have changed my daughter so much that she's unmarriageable in my village." And I took that seriously, because we've got to be able to bring the local community along, the family along, because what you have is you could end up putting that person in coming back from an education experience into a difficult situation unintentionally. And so the community level, whatever you do on the policy level, you've got to redouble your efforts at the village level, with faith leaders, with the family, because it, as I said in one of my bullet points, it is a family decision and you've got to bring them along.
Ambassador Kolker.
Yeah, I think that the basic part of your question, I don't think the problem is political leaders not advocating for girls' education. The idea in most African countries, there's a policy that education should be offered to boys and girls, and that at least sort of in the first grade, that tends to be the case, and that certainly is the rhetoric of the government. But there's a big difference between access and quality, as I pointed out. And some of the factors of what makes school attractive for kids or for families, what are the risks that girls face in school, have not been addressed at all. And just the question of teacher absences, which are huge in many cases, the teacher pay and working conditions, ability to live near rural schools, means that the actual supervision at those schools is sometimes lacking itself. I know in UNICEF, we actually financed a teenage study of girls recognizing their own vulnerability. When you're at school or when you walk to school, where do you feel unsafe? And where do you feel safe? Are there spots that you go that you know you'll be safe, a cafe or somebody's house or a well-lighted intersection? And it was fascinating because there were very distinct patterns among these Kenyan early teenagers of where they felt safe and where they felt vulnerable, but no one was addressing those issues. The schools weren't addressing them. The communities weren't. They weren't putting street lights in places where girls had to go home in the dark. They weren't addressing the case of abusive teachers who were exploiting their 6th or 7th graders. And so the sense of how does this policy translate down just among the officials and people who have some social responsibility is one. And then there of course are the community factors in which, if education is valued, like the situation Robin was describing, what are the social dynamics of that? And of course, in many African countries, including Uganda, there's essentially an overeducated population, and number of elementary school, high school, and university leavers who don't have jobs that use that education. Those people do tend to move to the cities. They tend to be connected through social networks, but they are a kind of Arab Spring waiting to happen of educated young people for whom the society really hasn't changed enough to make their investment in education pay off in terms of both the economic growth, but even the personal dynamics of where did those people fit in, how do they fit in to their family structures, and how do they fit into the emerging economies.
Thank you. There was mention made of food insecurity and how that adversely impacts the most vulnerable in the population, and this would be women and girls, because of their lack of access to education and lack of access to adequate healthcare. What do you think is being done across the continent to address the issue of food insecurity and the impact of climate change on food insecurity in African countries?
Well, one of the things with climate change, I've been a climate change advocate since Congo, so we're talking about 2005 and 6, because the Congo Basin is right there, and so we were working on climate change as far back as that time, and particularly on the food insecurity connected to that. And one of the things that I learned and that we also did and funded, again, it goes back to the local level, looking at ways to have community gardens. We did 2 things there that connected to both health and education on food. We tried to find out why the pygmy population in rural areas in Congo were not sending their kids to school, boys or girls. And one of the challenges we determined, working with a partner in the university, a university from Minnesota, with Native Americans, because they had same issues with Native American populations in the United States, was that we found that hunger, walking to school hungry, was a factor. And so what we did as, not 2 things, walking to school hungry was a factor, and 2, there was not adequate food or nutritional food in the home. So we addressed that 2 ways. We created community gardens with healthy food, all of that right there on the school grounds. And we allowed, we convinced the parents that if you brought your son or daughter to school, they would have 3 meals and you could have 2 meals. You as walking the parent, and when you come and get your son or daughter a meal at that time. Because when you have food insecurity, it's not just the individual, it's the whole family structure that's struggling. Again, it goes back to my focus on community, help people where they are, and how important that is on the food security aspect. It's exacerbated a little bit now because of the extent of climate change, but we still have to find local solutions to meet people where they are. So that's even in IDP camps, even in refugee camps, finding ways to have nutritious and adequate food in addition to what's being provided by aid workers, but certainly find ways to be able to have, when I say community gardens, I'm not talking about something small that we see here in the US on rooftops or anything like that. I'm talking about really large scale gardens for the community, and maybe that's a better way to phrase it. So I'll stop there.
Ambassador Kolker,
Thanks. Yeah, I'll pick up where Robin went. The examples she gave are good. There are a couple others of the idea of providing school meals, even if it's just a school lunch, which has been dramatically increased in Africa through McGovern-Dole, USAID Food for Peace program, which provides commodities specifically for school feeding, and has been, I think, a hugely successful program in keeping kids in school and making sure they get at least the 1 warm meal a day, often 2. And then there are also parts of that program which I think have had mixed results, frankly, but where there's a food distribution connected to school attendance. So if the child attends school 80% of the time during the month, the family gets a sack of grain or some oil or something to take home. And then I think an example that has been proven to be very effective is daycare in connection with the schools, because many of the young girls in particular, the reason they're not in school is that they need to take care of younger children. And that by having an opportunity for the younger children to simply have a play group or something that's supervised and safe at the school does allow better attendance, and also those younger children can take advantage of the school feeding programs as it might be. They're also, one of the keys about community health workers is that food insecurity often isn't reported or isn't seen as a political, economic, or societal problem. This is an individual family challenge, and we aren't collecting data on it or trying to do something about that to find out where there is, and it could be climate induced or seasonal food insecurities, and the sense that giving that as one of the sort of checklists that community health workers look at in their own communities, and to be able to assemble that information and see how it changes over time, see how it changes by geography, enables a government or even an NGO to be able to address that, and to address it in part by cash grants. I mean, I think we've also found good success where there's simply been a cash payment to food insecure populations, and they tend to use that very, very strategically for their family's basic needs. And I guess the last thing I'd mention is simply a relook at the whole agricultural basis, the subsistence agriculture basis of what that means in terms of climate change, of drought in the Sahel, of the reduction in rainforests. How are we looking at subsistence agriculture as a factor in both national economies, the whole workforce and educated workforce issue, but absolutely in terms of degradation and the fact that we need improved crops, and crops that are much better adapted than some of the traditional crops that many families have been planting for generations on their land, which aren't adequate anymore with increasing populations and worse climates.
Can I just add one more thing on that,
yeah, sure.
if possible, which is, a little bit of the everything we've mentioned, sort of the climate change pillar and the food security and health and education. There are a couple of really good examples out there of where international and local organizations have been extremely creative in how to address some of those things. And so I've seen programs where there's one in Kenya that I thought was really fascinating. It's where you had a lot of children, nomadic children that weren't able to be in school, didn't have adequate food, et cetera, because their families moved a lot. And so you had a very entrepreneurial approach to that, where this non-governmental organization created a mobile school that could be taken down when the nomadic moved, could be taken down, and then that would be mobile and move wherever the nomadic group went next. And the school could be put up in less than a day. You had dedicated teachers that moved along, or they rotated so that there was always an instructor in the mobile classroom. And I thought that was one of the most creative things that I've seen as well. Along with that, again, having that community garden or garden for a community that focuses on drought-resistant food products, all are being done. I know a lot of that has been impacted by COVID, and I'm hoping to come back. But that nexus has been linked a lot when you look at what I call the well-being pillars on the health side, which includes the food security aspect. And we do a lot of well-being pillars as a Gallup senior scientist. And so, looking at all those things as a continuum is something that we do quite a bit.
Okay, thank you. I could go on. I have dozens of more questions, but I think we should probably allow our audience to have a say. I would like to say one thing for those who might not recognize acronyms. IDP that Ambassador Sanders mentioned is internally displaced persons, and this is an issue that plagues many countries on the continent, either because of violence or climate-induced disasters that force people to relocate from their normal habitations into others. And that's a whole other discussion that we could get into as to how that impacts women and girls disproportionately as well. But with that, I will turn it over to President Flynn to moderate the questions from the audience.
Thank you. We have one question on the school dropout rate in Uganda, but I think let's broaden it beyond Uganda. How much is dropout due to the need for children to work? And I know you've touched on this a bit, but I wonder if you can also expand on it. Are there places with examples with good examples of dealing with this issue? And either one of you can take that.
Well, the study I cited from Innovations for Poverty Action did not actually make that next study that would say what were they did correlate economic opportunities with boys drop out of primary school, but there was not a more comprehensive or one that was specific to girls. I guess my guess is that the family demands would be more important in girls' cases compared to the idea of a job outside of the family. Especially one thing we haven't mentioned, but on the health side, the caregiver responsibility of women and girls. It's estimated that in Africa, 80%, in fact in the US as well, 80% of people who care for sick people, almost entirely uncompensated, but even outside of health facilities or health professionals, but non-professionals who are caring for sick people or sick children are female. And that obligation in the family to find someone who has to drop out of the workforce to do that, or to find an older child who might be able to care for a younger sick child, seems to me to be a key factor in some of the retention rates for girls in school, because academically they do better than boys in primary school.
Yeah, interesting. Another question I have.
Can I just add something on that?
Of course,
quickly?
of course.
you know, there's an ILO study that talks about worldwide this issue, but for Africa, Africa is the global area of the world that has the largest number of children impacted, particularly girls, by having to do either domestic labor and or labor in the fields. And so worldwide, the continent is at the highest. I was actually looking for the percentage figure in my notes because I do have that, but I don't have it at my ready at the moment. But the region is the highest in the world. So that tells us that on the policy level, probably also in the non-governmental community, we probably need to step up and find some remedial efforts to that. I have given some examples in my remarks about you know, trying to find financial compensation or incentives, you know, with small farm holders or in the family, so that the girl child can go to school or can get health care or can be away from home or can be away from the field. It's all about economics. If we don't find a way to help on the economic side with the families that are impacted, then Africa is still going to continue to be the highest in the world with child labor in those two areas, domestic and in the fields.
Thank you. One of the issues you raised was the issue of the educated young, and where there aren't real employment opportunities for them or not sufficient employment opportunities for them. My question is, what's the answer to that? And also, is this creating, you know, an exodus of the young educated, a brain drain? In other words, are they going elsewhere?
I brought that up, and I don't have studies that answer your question with evidence, but certainly there's an urbanization, and that means that rural communities lack, for instance, role models. That the question of, are there educated young people who are mentoring or helping to provide examples for primary age girls in the communities, few and far between. And I think the international brain drain, there's certainly areas like the Sahel that even before colonial times had labor migrations as a main part of their economic well-being. People from Burkina, for instance, went to the coast for work, even in traditional societies before the French built the ports there that ultimately hired some of them or had the cocoa farms. So there is a tradition of the child labor and of labor migration of societies that couldn't deal with the population increase or in the subsistence society. But I don't think there are many African societies that have fully addressed this. It's always named by political and economic leaders in Africa as the main challenge of this generation of what do we do with the predominantly young society and the huge boom in youth who are now educated, but for whom there aren't comparable jobs. Robin, I hope your organizations have solved that problem.
No, you know, it's a huge challenge, but again, everything is in the context of COVID. What I saw before COVID, and I work with some of those groups, is this really huge shift to localized entrepreneurship. And what I mean by that is programs encouraging young people to stay where they are, find entrepreneurial work within the communities where they are. It hasn't stemmed the huge rural to urban migration. I don't know if there's anything that will actually put a stop in it, but it has helped in some instances. And, you know, there's one project in Benin in particular, where I used to be chairman of the board. I'm still on the board of that, Songhai. One of the things that Songhai did, and then we brought some Songhai examples to Nigeria, was to try to encourage young people to look at farming in an entrepreneurial way. And so that if you are in the rural area, you know, can you make a living doing that? And how do you do that with aquaculture? Or how do you do that with a particular commodity? Or how do you be on the waste side of agriculture? how do you recycle that? And so Songhai was in mid 2000s with my first climate change focused project that I was part of, and the creativeness was just amazing. Where trash and other waste was recycled into machinery, farming machinery, and all of those were sub businesses that were entrepreneurial businesses connected to that. And so that was impressive. We even started 3D printing for spare parts so that you didn't have to try to, and that goes back to the mid 2000s. So there are entrepreneurial ways to address it. It doesn't mean it's going to stem it completely, but there are things that were being done, and hopefully post the heaviness of the pandemic, some of those things will come back.
Thank you, Ambassador Ray. Thank you, Ambassador Kolker and Dr. Sanders. Fascinating discussion. We have come to the end of our time. Before I let you all go, I'd like to once again mention our Thursday event in Washington, D.C. You can attend in person or via Zoom with Secretary of Energy of Kenya, Monica Juma, who was also the former Secretary of Foreign Affairs and of Defense. So it should be a very interesting topic. We also have an event at the end of the month on the 29th. The author, Isaac Stone Fish, has written a really fascinating book called America Second: How American Elites Are Making China Stronger. Very strong, very thought-provoking for those of you who watch China or just have an interest. So thank you again. Great conversation today about an important topic that I don't think we focus on nearly enough. So I appreciate our panelists and Ambassador Ray and our audience for being with us today. Thank you and take care.
Bye. Thank you.
Thank you.
Bye.